Today, I have been invited to represent American TelePhysicians. It is a revolutionary global healthcare project that provides a holistic approach to interconnected healthcare ecosystems. The organization's corporate goals follow the Agenda 2030 framework for providing access to quality healthcare to all, and currently are working in healthcare markets in the United States, in Australia, Mexico, Nigeria, in Kenya, Pakistan, and in the United Arab Emirates. American TelePhysicians is also a key partner of Sustainable Development Platform for Partnerships. The ECOSOC Forum and this discussion today, particularly as we come together, talking about emerging markets into the conversation around digitizing healthcare ecosystems during a very crucial time that we find ourselves in, is part of a planning process towards the road to the 2021 high-level political forum, which we at Blue Ridge Impact Consulting are working with organizations like American TelePhysicians to coordinate, support, and impact around multi-stakeholder approach to development. And our panelists today are working diligently towards aligning and implementing these guided principles along their respective organizational models. And today we will share insights, we will share best practices and challenges and recommendations specifically for localized and impactful development. So as a capacity building exercise, the idea is to connect young people with innovation while harnessing information communication technologies around the world towards decision making that is unique, that is insightful, coordinated, coherent, and of course part of a holistic system. So our intergenerational conversation will be held by Dr. Waqas Ahmed, who is the founder and CEO of American TelePhysicians. He is also a practicing nephrologist and hypertension specialist in Jacksonville, Florida. Dr. Ahmed has been named among the top 20 CEOs of telemedicine in 2020.
Respected panelists and the attendees from all over the world. And based on that, good morning, good afternoon, and good evening. This time we are focusing on the emerging market because the digital healthcare and is a universal phenomena, and COVID-19 obviously has impacted all over the world. And we have been so lucky to gather the team of a great panelists who have not only worked in their respective countries, but also have the pleasure having the speaker today with us, Dr. Irfan Ali, who is the president of the Pioneer Medical Group, who has led telemedicine programs at the Advent Healthcare system in the US, and also be part of the charity organizations too.
Thank you, Dr. Ahmed and Dr. Zia and all the panelists. I want to start with when you look at the COVID-19 pandemic, it has resulted in massive disruptions with healthcare, both directly as a result of the infectious disease outbreaks and indirectly because of the public health measures. And it required mitigation and how we are going to face those challenges. This disruption has caused rapid dynamic fluctuations in demand and capacity, and also the qualitative aspects of the healthcare. So digital technology and digital solutions, and whether we are using telehealth, artificial intelligence, any kind of decision support systems, triaging of clinical care, we need to think from a different mindset. Like Dr. Ahmed said, my name is Dr. Irfan Ali. I'm CEO, President of Pioneer Medical Group. Our main focus has been hospital medicine.
Thank you, Dr. Ahmed. I'm Dr. Fejiro Nwoko. Like he said, I'm a medical doctor here in Nigeria. I'm also the co-founder of Simplified Integrated Medicare. And what we do is that we provide telemedicine services to the informal sector. And we do that, we aim to provide quality primary health services to this group of people at a very affordable rate. We know that Nigeria and other African countries plagued with very low access to healthcare over 400 million people in Africa have little or no access to healthcare. So our organization is focused on providing healthcare to the sector, especially people that are in the rural communities or people, the urban poor, so people that do not have health insurance. So in line with sustainable development goals, in order to ensure universal health coverage for these people, we aim to provide a very affordable health service that is readily available to these people wherever they are. And we hope, and we do this with the aim of, increasing the manpower hours that is available to these people to work, so they do not have to leave their primary jobs just to travel long distances and wait in long queues to see the doctor, when they can have access to the doctor through a phone. And also they do not have to lose odd hours being hospitalized if they have primary health service on time and preventable health services, so that they do not fall ill. So that's what Simplified Integrated Medicare is doing in Nigeria and other African countries.
Let me also introduce our second speaker here, Dr. Giorgio Franyuti. He's a physician based in Mexico, part of the Medical Impact, and also been member of the United Nations session before.
Thank you so much, Dr. Waqas. Well, I, as Director General of Medical Impact, an NGO that provides humanitarian medical assistance to communities living under extreme marginalization, difficult access, natural disasters. We work as frontline health workers in very scarce, very severe conditions throughout Latin America and some parts of sub-Saharan Africa. Therefore, we are able to witness firsthand the consequences of inequality, social determinants that drive into vulnerable communities and populations into further problems and distancing us from achieving universal health coverage. Therefore, Medical Impact's mission is through multi-stakeholder approaches and intersectorial approaches, achieve or further achieve universal health coverage. And this can only be done through innovation and technology advances, through not only novel diagnostic tools and therapeutics, but also through means of communication, infrastructure, access to internet, and means to further achieve UHC and bring early access and quality access to primary healthcare to these populations that live under scarcity.
Now I'd like to introduce Dr. Tayyip Akhter, who is a Chief Medical Officer of Shifa for You project in Pakistan.
My name is Dr. Tayyip, and I am basically a medical specialist and gastroenterologist working at Center for Liver and Digestive Diseases, Holy Family Hospital, Rawalpindi. Being a clinician, my second interest is in telemedicine, and I am Chief Medical Officer of Shifa for You. It's actually a one-stop healthcare solution, and it is providing a 360-degree solution to its patients over here, and providing such a platform where the patients can come and get all their health-related issues addressed through digital media. Where they can have their laboratory issues, their radiological issues, you can say the drugs, the pharmacological related issues, and they can have consultations, online consultations. We have got a very strong team of IT consultants, clinical experts, telemedicine experts, and in combination, we are providing all these solutions to our patients. Apart from that we are also with our young team members, we are striving hard to educate our patients as well, and our strong social media network is striving day and night to educate our patients in their local languages as well as in international languages.
She's Dr. Tatyana Argila. She's Thom. She is a nephrologist and is originally from Brazil, but also has experience in working in both Brazil and the US. Dr. Tatyana, please.
I'm Dr. Tatyana De La Torre. I graduated from medical school in Brazil. And right after my graduation, I worked as an emergency room physician and also primary care. During this period, I started working, volunteering for a non-governmental organization that is determined to bring healthcare and get poverty-ridden northeastern arid area of Brazil. Some needed help because they are so far away from any kind of health resources, about 200, 300 miles many times. So in this period of time, I learned how those remote areas, a lot of times extremely poor ridden. I've noticed situations as sad as they digging a hole in the floor to put in the dirt to put their babies inside the hole so they would not feel cold due to lack of blankets, much less water or even healthcare. During this period, we learned that how, for instance, telehealth or any type of technology would help get to those areas where a lot of times even volunteers would get trouble getting in there. After that, I went to the United States. I did a residency at the University of Connecticut and then my nephrology specialty at Mayo Clinic. I returned to Brazil in 2017 and I saw that we did have some progress there, but during COVID, the pandemic, all those volunteers could not get there. And it took a long time until we were able to get internet and start serving those people that unfortunately a lot of times would not be able to get there. So that's where a lot of those platforms and satellite clinics can definitely help being, as Dr. Tayyab said, a one-stop to all the healthcare needs to those very remote areas.
With Dr. Ali, obviously from the US market perspective, obviously COVID hit, early 2019, and what was the biggest barrier you saw when you were trying to adopt telemedicine at the Pioneer Foundation or Pioneer in the US healthcare system?
Because really trying to figure it out. It's a new world. It's a new world. It was a scary world. We didn't know much about COVID. We didn't even know the treatments, that could work for COVID. And on top of that, now we are dealing with a population which is at a higher risk. And we decided that we have to think outside the box. This is never been seen. We need to have resources which are easy to use, which are a one-tap kind of a process, that we are not looking at a complex solution where people are going through laptops and multiple computers and logins. We consider the literacy rate, and then not just seeing the patient, but what do we do after that? If you can see the patient and you can recommend whatever you need to recommend, but what resources are available at the back end of it. So if you ask me, the simplest technology and the technology at both the ends, at the clinical end and at the receiving end, and then whatever the recommendations are at the clinical end, how do you make that into an actionable plan once the clinician suggests a certain thing to do? So if you need to provide medications, if you need to provide resources, you need to have a network who can do that. So we partnered up with the pharmacies, we partnered up with local churches, mosques, we partnered up with local counties, and even FEMA. So I think that tele is one part of it, which is a very important part, but connecting all the other ends, what you do after is something that we did well.
That's a very valid point, because I agree with you, because it's just concept of that connected healthcare system where basically because as a patient you need, after the doctor has seen you, they need labs, radiology, and pharmacy there. That brings me to question back to Tayyab, Dr. Akhter, when you were mentioning Shifa for you. Tell me, what was the biggest barrier of the adoption has been in Pakistan right now? And I know when the COVID happened, you guys also started a home hospital program. But tell us a little bit about that, and what were the barrier of adoption you saw?
Yes, definitely. When we started back in around 2017, it was not that easy. As Dr. Ali has said, that it was totally a new world for us. And whenever I go to different people and start discussing about the idea of telemedicine, I get a very overwhelming response, and everyone admires that. Yes, it is the demand of the day, and this is the need of the day, and everyone appreciates it. But when it comes to practically following it and practically implementation of the telemedicine and the digital health system.
During the United Nations high-level meeting on universal health coverage, there was one phrase that really resonated with me because I empathize with it. It is what drives me every day. The furthest come first. Now, when we talk about the furthest come first, I want you to imagine a normal situation for my team at the office, which is traveling 21 hours to get on some mountain in the state of Guerrero, and getting there with the vaccinations, with medical supplies. I cannot take a lot of healthcare professionals there because first they require specific training to be mobilized in such conditions, and secondly, there are not many healthcare professionals that can completely disconnect for 2 or 3 or 4 weeks, months, to stay at the mountain and continue the access to health, to primary healthcare or specialized healthcare for these communities. Now, it is not a matter of speed. In this matter, for the furthest left behind is the matter of infrastructure. Not only the physical one, but also the digital one. Some of those barriers have been overcome by solutions with satellite internet. However, it is not cost effective for the communities that do not have such income as a whole or even as individuals. Therefore, policymakers have to make a decision. Policymakers have to think whether or not it is cheaper to invest in internet access for such communities that will lead to innovations in telemedicine to be able to provide primary healthcare to these communities, and not spending extra money into getting such specialized professionals to us for medical impact as an intersectorial effort to bring such professionals. Let me tell you, it is expensive. Therefore, if we seek for specific solutions through the internet access, through the access of internet to these communities, we'll make it cheaper. We'll make it more affordable, accessible for people to grasp what quality care is. We have to dignify the access of healthcare for these communities, and that's one step into the solution. It will not solve the issue. We have yet to solve the issue of the supply chain of medications there, but at least we get the healthcare professional to solve and prevent issues on the communities. That is how we further achieve universal health coverage. We, for example, in the Mayan jungle, in the Lacandonian jungle, in the jungles in Colombia, we have used Smart Clinic, for example. And most of the times when internet connectivity is available, it works like a charm, because I cannot fly in a nephrologist to have an interconsultation there, but I can have a general practitioner interconsult for neurology, for internal medicine, nephrology, etc., 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 and widen the spectrum of my services while keeping the cost at safe. And that applies for the public sector as well as the CSOs and the government itself. Therefore, there's a win-win situation where technological innovation will translate into better healthcare for all.
We have done that, use the phone instead of, use a video, because again, most people are so remote and so spread out, they just don't have Wi-Fi. They don't have a computer. Actually, lots of people don't have a smartphone. So we have done through the phone, definitely better than nothing. But we are solving this situation now through those satellite clinics that will serve lots of people. And we have used satellite internet, and now they are being able to, purchase and install fiber optic internet. But for now, until we have all the platform, the telehealth platform, with all the computers and the tablets within the clinic. And of course, those people that live more remotely than even the clinics, they are actually picked up by buses and brought in. But the telephone for a while was actually our only solution.
Really, obviously you're running this now in the US. Essentially, we're in the post-COVID phase now. Vaccinations being done. Although you still see some COVID cases there. What role of the digital health are you seeing in the US market? What's the future trend is going to be this year?
I think that every time you're faced with a challenge, it opens up some opportunities too at the same time. I think that despite all the challenges with COVID, I think the access to healthcare and utilizing digital technology is going to go farther and farther. I think it is going to help in many ways, not just the patients with COVID, but those patients who used to come to the hospital, come to the clinic. I think the trend for these patients to be seen at home, especially a large majority of those patients, who don't need to be hospitalized, whether they have bronchitis or they need refill on their hypertensive medication or diabetic medications. I was talking to a group yesterday, and these physicians are providing. They monitor the patients at home, and if their condition is not getting better or it is getting worse, they have these mobile urgent care centers. They're connecting the digital technology back with an urgent care who goes to the patient's home and take care of them. So I think that it is just going to, we are going to see it more and more. And I think genomics is going to play a huge role with the digital technology. And as we connect and find more and more, we are going to see an expansion on that. I think telehealth devices, whether it is the pulse oximetry or if you're looking at their weight, or if you're looking at their vitals or AccuChecks, I think that those are becoming more and more prominent. So this is going to grow. I think this industry definitely is growing.
Just to, I'm approaching time, back to Dr. Amina Zia for the closing remarks, and obviously for the message she has for the United Nations and the ECOSOC leadership team for our recommendation based on this expert panels. Thank you so much, everyone. So let's see what Amina has to say. Thank you, Amina, to you.
Thank you, Dr. Waqas. As I sit here and I listen to all of our panelists share their experiences, I'm very appreciative of these very robust and very real discussions that highlight, the passion and the commitment and the very people-centric approach to development. Our team at Blue Ridge Impact Consulting will take these discussions and recommendations, and we'll share them with our panelists and audience, and also with the Youth Forum leadership, and of course with the ECOSOC President's Office. Thank you so much for this very insightful discussion.
Thank you so much, everyone. Thank you. Great.